Hi friends, this is a case where we have planned to implant a non-spheric monofocal lens. Here you can see as we are injecting the lens flipped, and I could have stopped it by using a second instrument, but it flipped and opened in a wrong way. You can see the haptics in the letter S. This is not the way the IOL should open. The correct way you can see in the side picture. It should open is a picture of 2. So what should I do? I have two options here. One to flip the lens into the AC and second to continue same. Here, as the lens is single piece non-aspheric lens, I opted for the second choice to continue with this position of the lens, as flipping the lens in the AC can damage the corneal endothelium. So I continued with this. Sometimes you don't need to go by the books. This will not affect the visual outcome also. Rotating the other haptic in the back, it will be tricky. You should use some visco and do it. Thank you.